diabetes still remains a challenge. But so it is very important for us to be actually screening the women, pregnant women, even though they are not showing any symptoms, right? So if we have a confirmed diagnosis, let's say, then what we need to do is we need to understand, if we have a confirmed diagnosis, then we need to basically implement three things. One is the MNT, which is the medical nutrition therapy, then the physical activity, and of course the weight maintenance. Okay, so what happens here in basically the women who are pregnant is that they're very easily adaptable to the change. You know, they very easily accept the change. So when you tell them that, okay, you might be having gestational diabetes, they'll be very happy to make any sort of lifestyle changes that you want. And lifestyle modifications have shown that 70 to 85% of the women can be saved with the failure of GDM. But in case we are not able to do so, because we are very time packed here. So you see, we have only 2 weeks of time to basically bring the woman down from MNT and not going further to a pharmacological treatment. Okay, so in this time frame, when we tell her that she has to be pricking herself, like Dr. Rutul highlighted that she has to be pricking herself, she would do. Like in normal scenarios, what they do is they would not accept in the first place that they have diabetes. The diagnosis and treatment is so difficult, the person would not accept in the first place. So medical nutrition therapy is described as carbohydrate meal plan. Okay, and this we aim at this one. So we aim at, like I said, mother's weight maintenance. We also want fetal health. We want to prevent nutritional ketosis. Okay, so exercise, however, is very important, and all the national and international guidelines have suggested that 30 minutes of exercise really helps. Now again, coming to the Wing study said that we can actually distribute this 30 minutes of exercise into 10 minutes fractions throughout the day, and that should be done post major meal. So post major meal, if the woman is exercising, she can do walking, she can do cycling, and this really helps in bringing down the glucose levels or managing the glucose throughout the day. I was in Netherlands for some time, and you won't believe how full-term pregnant women were cycling, and they were so active because they don't have any domestic help like we do, and we just be dependent on them. Well, so if we have a case of GDM, if we have the confirmed diagnosis, we need to understand what is her energy levels. Again, the ICMR-NIN 2020 guidelines suggest that we can add 350 calories in the second and the third trimester. However, in the first trimester, we should not be adding any extra calories, and we should not be letting the mother gain weight. So IOM, the Institute of Medicine, also suggests that there should be no weight loss. So we come back where that we have a very limited time frame of 2 weeks to bring her glucose levels in less than 95 and the fasting glucose levels in less than 95 in just 2 weeks of implementing the MNT, right? Now, medical nutrition therapy, like I said, we have to focus on the mother's health, the health of the womb, and we also want to make sure that she is getting 175 grams of carbohydrates throughout the day, 70 grams of proteins, and around 25 to 40 grams of fiber throughout the day. When we are aiming at 25 to 40 grams of fiber per day, then we are basically talking about a whole food diet. A whole food diet is mostly misunderstood by people, mostly misunderstood by a layman, because they will just see the packet and they will say, oh, it's a whole meal bread or a whole food or a whole wheat sort of a thing, right? But when we say whole food diet, it should be as close to nature as possible. So whole food means a whole fruit. Let's take an example of wheat per se. Okay, so when the wheat is basically milled, right? So what happens is the bran is taken off. After the bran is taken off, we have endosperm and we have germ, right? Germ, after germ oil, etc. is taken off, we have dalia, which is broken wheat. So broken wheat is low GI. Then what happens is that suji is taken off. Then wheat is taken off. Then maida is taken off. So maida is wheat, white flour, and everybody knows that it is refined. So we should not be having white bread, etc., etc. But what is wheat? Wheat is again the second stage of processing. So we should consider it as a processed food. So when we are giving a diet plan to a woman who is actually having GDM, we need to tell her that, okay, let's consider having low GI foods, which is a dalia per se, and leave the wheat flour behind, and or maybe suji at some time, because that is again a medium GI food. We can easily modify our Indian traditional recipes in a way that we can, the simple roti, which is a wheat roti, we can add protein and fiber to it by adding some gram flour, by adding some oats to it. So what did we do? Basically, we improved the postprandial glucose levels by adding more protein and by adding more fiber to the same chapatis, the same traditional recipe which she was having earlier. Okay, so we made it from high GI to a low GI food. When we are having a mother who actually is diagnosed, the counseling part is very important, and making the mother aware of the carbohydrates is again very important. So what do we want to do? We want to tell her that, okay, how you should be basically distributing your carbohydrates throughout the day is by having 15 grams of carbohydrate snack, let's say in the evening, and let's say 2 to 3 or 3 parts in the morning, and lunch and dinner should be another 3 to 4 parts. So let's say if I have to give her a snack in the evening, I would prefer giving her 2 pieces of dokla or 2 pieces of idli, or maybe just ask her to soak some chia seeds and have a yogurt chia pudding, right? This might seem very normal talk to you guys, because it is like everyday lecture for you, right? The dietitians here. Is it? You read it in your basic... Okay, so coming to the protein. Protein is extremely important. Why? Because it is basically responsible for the synthesis of not only the maternal tissues, the fetal, and also the placental tissues. So protein should be, the ICMR NIN guidelines suggest, the 2020 guidelines suggest 20 to 25% of protein should be there in the diet, which comes out to be approximately 70 grams. Now, Indian women are very happy eating their roti sabjis, and they don't want to add any proteins, and they'll say, okay ma'am, I had a bowl of dal, for example, or there may be sick days when they cannot have so much of food. So what do we need to do on those days is, like Dr. Rutul said, that we might want to give them a little protein powder or a little addition supplement on that, yeah? But there are studies to prove, and randomized controlled trials to prove, that carbohydrate, first of all, if we are having let's say a low GI and a complex carbohydrate diet, that would be a better, that would prove to be better glycemic control when if the PPG levels are controlled with a complex carbohydrate, as compared to the restrictive carbohydrate diets, when we are restricting the total amount of carbohydrates. Same goes for protein. If we are giving them a lot of protein, which is protein in every meal, then we are eventually balancing, or we are actually blunting the curve, blunting the glucose spike, right? This is the most important slide. So I'm actually, making it a little faster for you guys, because we are already time packed here. So the most important slide is the fat. Why I say that? Because nuts and seeds are basically very good sources of fiber, antioxidants, mufa, we all know that. The saturated fats, however, how do they come into our plate? In the form of ghee, in the form of oil, in the form of palm oil, the butter, and everything. But the trans fats are there in packed food. So I had a client, and she was, in fact, every pregnant woman should get a personalized diet plan for that matter. So she came to me and she said that I want a diet plan for myself, so that there is a proper weight gain during the pregnancy. So I gave her some yarn that, okay, you should not be having all these packed foods and stuff like that. She was very happy. Then she came for the next session. When she came for the next session, she tells me, ma'am, I'm not having any packed food, no biscuits, nothing. But yes, sometimes I want to snack on something. So there is a bakery shop next to my house, and I get fresh fried samosas from there, freshly fried kachoris from there. And I told her, what are you doing? You're basically having the trans fat, which is the oil the guy was, frying it throughout the day. So it was basically converting into hydrogenated fat, and you are consuming that just to save yourself from some packed food here. So, and then comes the NIN guidelines, which suggest that, okay, 30 grams of fat is something that we should be having in visible form. So visible 30 grams of fat, when we tell them, this is what we give them. Right? We know these measuring spoons, we give them the measuring spoons. Now they say 30 grams of fat, this is 10 grams of fat. So the 10 grams of fat, when we give to them that, okay, this is the spoon that you should be using for your cooking and stuff, this is itna to hum roti pe laga dete hain. So this is what they should be managing actually throughout the day in their curries and their vegetables. So this is the 3 spoons of this is what they should be visibly adding to their meals. Then when we say the fruit serving, this is what we show to them, that this is 1 fruit serving for a diabetic, and this is how you can, actually measure it with your fist. Where the tricky part goes is the rice. This is 1 cup of rice, 1 cup of cooked rice. And they have much more of it. So when at the end of the day, when they are actually controlling measuring their glucose levels, they say, ma'am, I don't know, I'm eating everything that you are saying, but still the glucose levels are not going down because I am giving you this much rice and you are eating a full plate of rice. So the carbohydrates are increasing there. So not only the quality, the quantity, the amount, the digestion and the absorption of carbohydrates do matter eventually. This is a sample diet plan which I give to my clients, and if you see, it is basically covering the protein and the fiber in the morning. It is covering the standard meal plate that we should be considering when we say vegetables. It is covering a salad, which is again veggies, then there is a lot of fiber in the form of vegetables. There are studies, like Dr. Rutul was saying, the protein shield, right? The protein shield is basically, if I'm having salad first, vegetables, proteins, then having the chapatis and rice, then eventually I am blunting the glucose spike. So there are many studies to prove this. So what I've done here is given her lunch, which is starting from a salad, then a protein, then a vegetable. Eventually I want her to have her rice and chapatis in the end. And the evening snack is also, again, balanced in a way that she is getting approximately 30 to 40 grams of carbohydrates in the evening snack. So eat the rainbow, that's what I tell everybody. Eat the rainbow, is as much as colored fruits and vegetables as possible, and good quality proteins. Now coming to supplements. Their B12 supplement is something that most of the people don't know, and they don't know that B12 is something that they're not getting from diet at all. So deficiency of B12 vitamin, the results presented here have shown no association between the maternal B12 concentration during the first trimester. However, low vitamin B12 concentrations in the second and the third trimester of pregnancy was related to an increased risk. Same goes for vitamin D. Some evidence has shown that vitamin D deficiency may increase the risk of GDM, and there were several studies on probiotics. When the probiotics came into place, this is what I really wanted to highlight here, which is the 9 clinical trials involving 1,053 participants were included in this meta-analysis, and lactobacillus species were given to them. So the results showed that the probiotics significantly improved the glycemic control biomarkers, which is what we want, the fasting plasma glucose and the insulin sensitivity. Then the omega-3 supplements, again, omega-3 supplements can decrease the level of fasting plasma glucose and inflammatory factors, enhance blood lipid metabolism, and reduce the insulin in patients with GDM. To conclude, lifestyle behavior interventions is the cornerstone management to ensure that the metabolic needs of pregnancy are met. We need normoglycemia, we need to avoid nutritional ketosis. Emphasis should be made on choosing the right type, amount, distribution of carbohydrates, which is most important macronutrient, because that is what basically affects the postprandial glucose spikes and the postprandial glucose levels. And in addition, the women with GDM are encouraged to indulge in moderate activity, in moderate about 30 minutes, like I said. most important, which I think almost all doctors have covered, that postpartum follow-up for diabetes testing and lifestyle modification is crucial to prevent the delayed progression of diabetes in future and of future generations. Thank you. I didn't see that.